So Ron, let me set you up with what I think you'll find an easy question.
Finally.
In my lab, hypothetically, we build a, let's say, a diagnostic system or a therapy planning system, and it is phenomenally better than anything that you as a cardiologist used to do or that doctors are able to do today.
That wouldn't be hard.
Let's say it's 99% accurate.
Mm-hmm.
Wouldn't that sweep the world?
It's possible. But I ask you, how is it going to affect the cardiologist's income, their job status? Currently, a lot of the applications that have received FDA clearance are in radiology, because the data is digitized and it makes itself more available for analysis. However, something that people don't realize is a few years ago, American College of Radiologists realized this could be a threat to the radiologist's job and their incomes. So they've stepped in, they've taken over the process, they're making sure that not a penny of the radiologist's income is affected. They're asking for very robust clinical trials, which they should be, to validate the outcomes that if you're using an AI algorithm to read a radiology scan, it needs to do prospective multi-center trials just like a drug and show that it's improving outcomes. So you're talking about pushing things out for years. Those trials take years to do, analyze, publish. You need to do multiple publications before you change standard practice. So the idea that physicians are going to sit idle and allow your 99% accurate decision support change how things are done, that would be to their detriment, would be a pipe dream.
That's unpleasant, but probably true. I do remember just before the pandemic, I was giving a talk to an international conference of doctors, and it wasn't particularly about replacing them or even augmenting them. It was just the general state of AI. And when I finished my talk, the first question from the audience was, am I going to lose my job? And so that's a real concern. I assured him that he wouldn't, but of course I have no real basis for saying that because I don't make those decisions.
Well, 2 nights ago, we had the first book launch event in New York. I gave a talk that I talked about the fact that we've solved a lot of problems in the last 100 years. Anesthesia, vaccines, antibiotics. Life expectancy's gone from 35 to 80 to over 80. In France, it's 83. The United States has the lowest life expectancy of any OECD countries. With this progress comes a lot of new problems. People who live long enough to develop chronic diseases. People who now are older, frail, and need to be taken care of. If we want to do chronic disease management and keep people out of the emergency rooms and hospitals and lower cost of care, that's a lot of work. We don't have the enough manpower to practice the kind of medicine, the reactive institution-based medicine that we're doing today. So if you're saying we're going to take on a whole new set of activities to proactively manage patients outside of the clinical setting, I'd say forget about it. It's not possible. But with the help of technology, it could become possible. So in that situation, I would argue there is so much to do. You need all the humans you can get, plus AI, to do a good job with this new model of care that we've anticipated, we've discussed, but hasn't happened yet. So I think everybody could rest easy that their jobs are safe. I tell the story that when I was running Acupera, I was on a panel with Vinod Khosla, who said, this is 10 years ago, he said, in 5 years, we're not going to need radiologists. So here we are, 10 years later, we've never had a bigger shortage of radiologists than we do today. When I was going through medical school, the talk was that you can start managing chronic diseases like heart failure and HIV. At the time, AIDS was a problem. People were getting hospitalized. With AIDS, that everything would be outpatient. We wouldn't need all these hospitals. Look, it's 20 years later. Hospitals have never been more full. We don't have enough hospitals. We haven't trained enough doctors because we did not take into account increased life expectancy and all the problems that come with it. So I think we're going to need AI to help us because we don't have enough manpower, and that's the #1 problem in healthcare right now.